Does anyone have any general questions they want to ask me before? Yeah.
The recovery time on the lipo.
The neck. So we like to do this procedure on a Thursday. So we bring you in on a Thursday, and the reason for that is then we can touch base with you on a Friday. So we bring you in on a Thursday. Procedure for the neck takes about 45 minutes. Right, most of that is numbing time. The procedure itself is pretty quick. We send you home that day. We put an ACE wrap around because we do tighten that, but we want it to stay up. We check in with you again on Friday. We tell you to take it easy over the weekend and keep that ACE wrap on Saturday and Sunday. Take it off and go back to work on Monday. Yeah?
What about any estimate in terms of inches? I mean, I saw some of the stuff around the belly stuff, and then 3 months later at the end of it, I mean, are there?
Well, I think inches are really, I think inches are hard because it has to do with like what you started with.
Yeah.
So the best guesstimate that I could say is, again, in any spot, you can estimate that you probably will lose about 1/4 of the fat in that area. So if you think about it, it's probably like 1 pound or 2 of fat, but 1 pound or 2 of fat all over your body is not very much fat. 1 pound or 2 of fat in one area is a whole lot of fat, if that answers. Yeah?
Why can't you use the Coolsculpting on arms and legs?
Has to do with the applicator. Has to do with the way that the fat is pulled into the applicator. And so, maybe at some point, the company will be able to, and Kristen, you of course can address that too, will be able to come up exactly with different size applicators. I know they had been working on one for the arm, but it wasn't getting an effective result. So we don't like to bring things out that are going to make people anything other than happy. So at this point, because we don't have that, we're treating with the others.
It's the machine. It's not like the fat.
That's correct. That's correct. It's a limitation of the machine on how you get that fat into the machine to freeze it, right? So these are trickier spots. Other general question? Yes, Deb.
Talk about bruising with the lipo.
I'll talk about bruising with both. So with the Coolsculpting, as Kristen was saying, is pulling your fat into, an applicator about 1.5 inches wide and pinching it for an hour. So some people tend to bruise a little bit. We honestly haven't seen a lot of that, but it is a possibility. In general, with that, people mostly just feel kind of sore because someone's been pinching you for an hour. So you kind of have a sore feeling for the next day or two. With the Smartlipo, because if you remember, I said what I do is I insert a little cannula and then I feed a laser fiber in there, and it's got the 3 wavelengths of light, one that melts fat, one that coagulates blood vessels, and one that tightens skin. Because of that, you actually don't get that much bruising because as you're going, you're clotting off blood vessels. Yes, you're hitting things because it is minimally invasive. It's not non-invasive. So you are hitting some blood vessels, but you're clotting as you go. So you tend to not get a whole lot of bruising with that procedure. And it's certainly a whole lot less than traditional liposuction, which unfortunately does have a lot of bruising and a lot of downtime. So the difference is really a lot of reduction in terms of downtime, bruising. The recovery is a whole lot faster. Others? Good. Okay, well, let's break down then. We're going to rearrange the room a little so I can go ahead and take some consultations. And please, everybody, have some food and wine. And thanks again for coming.